Um, Marianne and Nikki, are you guys all set?
We're all set.
We're ready when you are.
Okay, terrific. Well, good afternoon, everyone. Thank you so much for joining us for this webinar addressing a byproduct of the opioid addiction crisis, commercial sexual exploitation. If you would like to access captions for this webinar, there's a link at the bottom of the slide you can click on, and you'll see the captions. I'm your host, Susan Halpin. I'm the Education and Outreach Coordinator for the New England region of the National Network of Libraries of Medicine. My office is located at the University of Massachusetts Medical School in Worcester, Massachusetts. I just wanted to let you know that this webinar is being recorded, and you will receive a link to the recording and the presentation slides shortly after the webinar is over. The webinar will last about 40 to 45 minutes. If you have questions about what you're seeing or hearing, we ask you to jot down those questions, and then we'll save the last 10 minutes or so for you to ask your questions in the chat box. All right. I just wanted to take just a couple of minutes to let you know about the National Library of Medicine in case there are some people here who aren't familiar with it. The National Library of Medicine is actually a physical library that's located on the campus of the National Institute of Health. The library has made all of its resources available online, and anyone can access this information at no cost. The mission of the National Library of Medicine is to advance the progress of medicine and improve public health by making biomedical information accessible to everyone. So NLM, which is short for the National Library, carries out its mission through a national network that has about 7,000 members. These network members are librarians, healthcare providers, public health professionals, educators, students, researchers, first responders, and consumers. And the network provided training to about 77,000 people last year. Because we're talking about issues related to substance use disorder, I just wanted to let you know that NLM has some fabulous resources about all different topics related to substance use disorder. So this slide actually has a bunch of links that you can find out information for, and the first bullet in particular is a portal, and it addresses topics such as understanding addiction, prescribing opioids, pregnancy, opioid use, recovery, data, trends, and statistics. Okay, and then just lastly in this introduction, I wanted to let you know if you are involved with creating any kind of programming, the New England region has a graphic medicine book club where they lend out book club kits to organizations. Right now, they only lend out to those organizations in New England. However, these kits could be especially helpful if you're dealing with topics that are hard to discuss, such as substance use disorder or mental illness. So each of these kits includes 6 copies of the graphic novel, a quick guide to reading comics. It has discussion questions and topics related to Medline Plus information. It links the topics that are discussed to Medline Plus. All right. Now I'd like to introduce our speakers for this webinar. Nicole Bell is the Executive Director and founder of the nonprofit organization LIFT, which stands for Living in Freedom Together, and LIFT is located in Worcester, Massachusetts. Dr. Marianne Sarkis is the Assistant Professor of International Development and Social Change at Clark University in Worcester, Mass. Dr. Sarkis is also on the Board of Directors for the LIFT organization. All right, and I'm going to turn the presentation over to them. You can just bear with me for a second. All right, I think we're all set to go.
Okay. Good afternoon, everybody. So my name is Nicole, and as Susan said, I am the director and founder of Living in Freedom Together. I am also a survivor of the commercial sex trade. And so we're just going to get started here with just kind of the objectives for the workshop. And commercial sexual exploitation is a complex issue encompassing gender inequality, poverty, trauma, substance use and abuse, and mental health issues. One of the biggest barriers to survivors accessing treatment is judgment and stigma. In one study, only 35% of their survivors told their primary care physicians about their involvement in prostitution. So we're hoping that this presentation helps you as practitioners become more sensitive to and recognize when your participants are victims of the commercial sex industry.
We're also, so the objectives that we are suggesting is we wanted to explore with you, or we'll be learning what human trafficking, commercial sexual exploitation is, and we wanted to debunk some of the commonly held misconceptions about that. We also wanted to give you some facts and statistics about prostitution, how to recognize the warning signs and the red flags to help identify victims, the do's and don'ts of working with victims and survivors, and also give you some tools and resources to assist this marginalized and vulnerable group of individuals.
Great. So Living in Freedom Together is a survivor-led organization, and our mission is to provide resources, advocacy, and support to empower individuals to exit and recover from the impacts of commercial sexual exploitation. We also aim to promote community awareness of commercial sexual exploitation through targeted outreach and education. And we envision a community where for so long these women who were shunned are now embraced with dignity, choices, and inclusion. Some of the programs that we work with that we run at LIFT is we have a drop-in center for high-risk individuals that are involved in street-level prostitution, where we provide survivors with Narcan, HIV testing, other STI testing. We're working to provide medical care, and all of this happens right on site, so it's literally on the block where the prostitution is taking place. We also are running educational and support groups for incarcerated survivors and survivors that are in substance use programs, and we also provide mentoring and leadership opportunities to exited survivors. So the definition of sexual exploitation is a practice by which a person achieves sexual gratification, financial gain, or advancement through the abuse or exploitation of a person's sexuality by abrogating this person's right to equality, dignity, autonomy, and physical and mental well-being. I like this definition because it really emphasizes the loss of identity and basic rights that are taken when you're a victim of commercial sexual exploitation. I believe that commercial sexual exploitation is the most violent form of gender-based violence. It really, truly is a human rights issue. I believe that every human being has the right to not be bought and sold.
So when we talk about commercial sexual exploitation, we're talking about power differentials between the buyers and the victims. So this is a really good way of looking at it. So sexual exploitation preys upon women and children made vulnerable by poverty and economic development policies and practices, refugees and displaced persons, and on women in the migrating process. So this tells us from here that the drivers of prostitution are going to be very different between men, you know, on the demand side and also on the women's side or the victim's side. So this is really important for us to understand that it is a power differential, that there are victims that are being preyed upon.
So these are just some of the forms of commercial sexual exploitation, from street prostitution, pornography, stripping, erotic and nude massage, escort services, phone sex lines, private parties, gang and organized crime-based exploitation, familial pimping, and forms of internet-based exploitation. Sorry about that. Some of the things that we're really seeing now is a lot of gangs and organized crimes are getting involved in the commercial sex trade. When you think about, you know, the selling of human beings from the gang perspective, it's safer than guns and drugs, number one. If you get caught with a woman, there's no red flags that are raised. And also from the perspective, it's very profitable for them. You can sell a gun once and you can sell a bag of heroin once, but unfortunately you can sell a woman over and over and over again. So the profits are immense for gangs and organized crimes, and we're seeing a lot of cases like that pop up even locally here in Worcester. Also, we're seeing familial pimping on the rise with the opiate crisis happening. Unfortunately, we know that substance use disorder runs in families, right? And so what happens is women are being pushed into the commercial sex trade by their parents, by their mother, essentially often. And so we're seeing a lot of women being exploited in that way.
And one of the reasons why the change in language is also very important, by not just talking about, you know, street-level prostitution, by using commercial sexual exploitation, it includes all these other aspects of the exploitation process. So as you can see, a lot of these are hidden exploitations, so they're not immediately in our faces, right? So when we are talking, again, about commercial sexual exploitation, it's really important to keep in mind that this is a wide range of different activities, but the end result is the same, which is the exploitation.
So sex trafficking is the recruitment, harboring, transportation, provision, or obtaining of a person for a commercial sex act, which a commercial sex act is induced by force, fraud, or coercion, or in which the person induced to perform such an act has not reached the age of 18. So when somebody's under 18 years old, you do not need to prove force, fraud, or coercion. Different states have different statutes around this. Massachusetts has a very open one right now. One of the state police officers that I work with said that you could literally indict a ham sandwich for human trafficking right now, the way our law is written. But unfortunately, these cases are very, very difficult to bring to justice because often the victims are struggling with substance use disorder. They're a vulnerable population, and so oftentimes these cases aren't being brought to justice. Also, I think it's really important to recognize that there is not always a third party profiting off somebody's exploitation, right? So there's a big push to be talking about human trafficking right now, which is great. It's getting some attention. But I also think it's important to realize that human trafficking and sex trafficking is one doorway into the systems of prostitution. So when we're focusing on this one doorway, we're looking at, it creates this dialogue of, you know, these sex trafficking victims are worthy of support and help, and these other women in prostitution are something different. And, you know, just the act itself of being bought and sold is traumatizing. It has, like, immense consequences on somebody's psyche. And so it's important to recognize that whether it's trafficking or not, exploitation and prostitution is harmful. So So we're just giving you some examples of sexual exploitation that don't fit into the trafficking definition. So when no money is exchanging hands, so the commercial element does not exist because it's not a money-making venture, right? So that could be situations that we have here, like where a young woman's drawn into an S&M situation, and the husband and wife, with a husband and wife, and are forced into sexually degrading situations. Photos and videos are taken, and substances are used to increase cooperation. So there's no money exchanging hands here, so it doesn't make it trafficking, right? But again, you can imagine the harm that this causes to somebody. Or a man lets his fellow gangbangers borrow his girlfriend, and she's passed around for sexual favors. Again, the commercial element is not there, so it would not fit into the trafficking definition. And then also, if there's no trafficker or pimp, so a person who's controlling the victim or benefiting financially. A woman, when you're engaging in survival sex, so exchange sex for money, food, or a place to stay. When somebody is coerced into having sex with a police officer in order to avoid arrest. And a woman's addicted to opiates or heroin and has sex with their dealer when she doesn't have any money and is in withdrawal. Again, you'll notice there's never a commercial element because money never exchanged hands. All sexual exploitation isn't trafficking, but all trafficking is commercial sexual exploitation. So again, I think it's important to realize that there may not always be the third party profiting, or they may not be the commercial element, but it is important to recognize that all of these things are harmful. And so when we're talking about trafficking, it's one of the fastest and most profitable industries in the world. It surpasses gun and drugs and trafficking. It's fueled by the demand for prostitution and engagement in illicit sex, especially with minors. And it's fueled by a supply and demand chain that spans the globe. And it's very difficult to expose and disrupt. Now we're seeing we're seeing websites that are facilitating trafficking. We're seeing, a huge increase in all of this, and a lot of the drive there is the commercial sex industry. It's within the commercial sex industry, it's the opiate epidemic. Women are being forced into prostitution to support their habits. Women are being sold by traffickers and coerced with substances. Women with opiate addictions this is another vulnerability factor that's exploited. And when we're talking about trafficking and prostitution, it's really important for us to recognize that all of this it's fueled by the demand aspect, right? So if men weren't purchasing women, children, and boys, and men, I often say women simply because that's the most common dynamic is men purchasing women and children. But there are male victims. But if men weren't purchasing victims, then a trafficker wouldn't be selling them, right? If men weren't purchasing women, they wouldn't be standing on a corner. So it's important to recognize what is fueling all of this, the commercial sex trade.
So if we're looking at the global network of trafficking, the State Department estimates that there are 4.5 million individuals who are in forced sexual exploitation. And about 14,500 to 17,500 individuals are trafficked into the U.S. each year. 99% of those trafficked are women and girls, and 55% of them are children.
I think it's important to realize this is a really underreported crime as well. So these numbers it's difficult to get accurate statistics within prostitution and trafficking because it's often not reported. Women aren't disclosing what's happening to them for numerous reasons, including shame and stigma.
So in the U.S., at least 100,000 to 300,000 youth are at risk of commercial sexual exploitation annually in the U.S., and at least 100,000 children are used in prostitution every year in the United States. So to dig deeper into some of the patterns that we are seeing, 100,000 to 300,000 underage girls also between the ages of 12 and 14 years old are at risk of being sold for sex in the U.S. every year. So the risks are really high, especially around that age. And we'll talk later on about childhood trauma and the link that we have found between childhood trauma, early childhood trauma, and prostitution and substance use. So this age is, increases the vulnerability. The boys and transgender youth enter into prostitution on average between 11 and 13 years old. Around 70% of sexually exploited women meet the criteria for PTSD. 73% have faced homelessness. 80% were victims of rape and sexual assault, and 90% of the women in prostitution want to leave immediately but feel they have little or no options. And this raises a question mark on this whole idea about choice. What we have seen and what we know from the population that we work with is that women do want to leave. They just don't know how, and they don't think they can either. So on average, a young girl is sold more than 15 times a day. Again, as Nikki was saying earlier, you can sell guns and you can sell drugs only once, but with prostitution, you could sell the individual repeatedly. So 1 in 3 homeless children gets lured into prostitution within the first 48 hours of being alone on the streets. And this is quite alarming because we know that there are so many individuals, so many young people who are runaways or they are in the protection of social services. And so here you can see some data, 86% of the runaways were in the care of social services when they ran away. So that, again, increases their vulnerability and the risk factors.
So this is just some of the risk factors, right? So for kids that are potentially at risk of being exploited, right? So when I just want you to kind of look at some of these things, and they're under 18 years old. If they walk to the store alone, they have access to a computer or a smartphone. They're attracted to consumer goods, so to desire to develop romantic relationships. Someone who sometimes feels insecure or misunderstood, that fights with their parents and sometimes feel that their parents don't care. A kid that wants more independence, someone that tests boundaries and takes risks. So when you look at this, right, so this is some of the risk things that make someone vulnerable to being exploited. And when you look at these, it's really all kids, right? So I don't know any teenager that hasn't experienced most, if not all of those things, right? So when we're looking at that, those are people that are at risk for being exploited into the commercial sex trade. And when we're talking about individual risk factors for the commercial sexual exploitation of children, so sexual abuse, physical abuse, and neglect at home is a huge risk factor. Runaway or throwaway kids, unfortunately, as they're labeled, or homeless. Identification as lesbian, gay, bisexual, transgender, questioning. A child with mental health issues, unaddressed trauma, and developmental learning disabilities. So a 1994 National Institute of Justice report claims that sexually abused children are 28% more likely to be arrested for prostitution at some point in their lives than peers who did not suffer abuse. And the National Institute for Missing, Runaway, and Throwaway Kids estimated that 1.6 million children run away from home each year, and that 1 out of 3 teens on the street will be lured toward the commercial sex industry within 48 hours of leaving home, right? So those are pretty scary statistics. We know that traffickers hang around bus stations or things that they're homeless shelters for kids. Anywhere that there are vulnerable children, that's where traffickers are preying upon. And so when they're saying 28% are more likely to be arrested for prostitution, we know that over 85% of women in prostitution have experienced sexual abuse as children, right? So we know that that's a huge factor in all of this. So we're going to talk about substance use disorder and prostitution. You'll notice I use the word prostitution a lot. People shy away from that, but unless we're talking about systems of prostitution, we're not going to end them. So we're seeing stories like this splashed all over the news. This story is local. It's in the city that we're actually working in currently. And so 7 people were indicted on charges that they were involved in a prostitution ring that preyed upon women with heroin addictions, right? So stories like these are splashed all over the headlines across our nation. They targeted women with addictions, held them in a hotel room, forcing them to meet a quota before supplying them with their heroin. This is out of Boston, which is 40 miles away for us. And again, a story in the Boston Herald about how the opiate epidemic is impacting the sex trade. This story highlights how traffickers are recruiting women outside of methadone clinics and treatment centers and preying upon their addictions. And this was a case in Philadelphia where the woman told troopers that he bragged about selling opiate pills and heroin to the women working for him as a way of controlling them. When she told them that she didn't like buying and supplying heroin in the hotel room, he threatened her with a knife. A second victim testified before the grand jury that she needed money to fuel her drug addiction and began working for them because she believed they ran an escort service, not a prostitution ring. She testified that she really slept and was sent multiple times in an Uber to be exploited. So it's challenging because, again, traffickers are preying on women's substance use disorder. And this is a quote from another survivor, and it said, "Substances were the easy part. I recovered from substance use disorder, but I'm still recovering from the aftermath of prostitution. It takes a lifetime to heal. It affects every aspect of my life, from my relationships, my marriage, and my work. I'm 20 years out, and I'm still healing." So the impacts, the negative impacts of prostitution are immense and challenging to overcome. So impacts of commercial sexual exploitation on victims. So there's physical impacts. We're seeing a lot of women with traumatic brain injury. We're seeing women that are branded. Continuous physical abuse, rape and gang rape, sexually transmitted infections, HIV and AIDS, pregnancy. You see a lot of traffickers get women pregnant and then use this child as a way to keep these women in the life, right? Tattoos and physical branding is something that is really common. You'll often see tattoos in places that are really visible, like across a woman's neck. Substance use disorder, cutting, and self-mutilation. Over 97% of the survivors that we've worked with at LIFT have an addiction. And for a lot of them, that is how they've survived getting through the life. I heard another survivor say recently at a conference in Villanova that the drug use kept her alive. If she wasn't using drugs, that she would have been in a mental institution because her mind couldn't have handled it. We see a lot of suicide and death. You know, we've lost 14 women over the last 2 years that we've been working with at LIFT. That's 10% of the women that we've worked with. Emotional and spiritual impacts, anger and rage, deep emotional pain and grieving. Humiliation and shame is a huge one. The stigma of exploitation, self-blame and hatred, loss of sexual desire, hopelessness, lack of belief in humanity and or a higher power. I experienced myself a lot of these things. I still struggle with a healthy sexual relationship. I still struggle with shame. You know, it's something that impacts you forever.
So this is, again, to give you some data about the experiences of women in the sex industry. 63% of respondents had been raped in prostitution, and again, this number is probably severely undercounted because a lot of women don't report being raped while they are in prostitution. 71% had experienced physical assault in prostitution, and this is common because, you know, when men pay for women, they believe that she is their property for the time being so that they can do whatever they want. And a lot of them end up being assaulted. 75% were currently or formerly homeless. 89% said that they wanted to escape prostitution immediately, again, but lacked the means to do so. 68% meet the criteria for PTSD. And 78% of, this is a survey that was done with women, 78% of the 55 women who sought help from the Council of Prostitution Alternatives in 1991 reported being raped an average of 16 times a year by traffickers, and were raped 33 times a year by sex buyers. So rapes and physical assault are ongoing, and it's just part of the life.
I also want to add to that, that as you can see by these numbers, sexual violence is often considered part of the job by victims in prostitution. This is why when the conversation about sex work comes up, I often question, like, what kind of job do you have to protect yourself from countless rapes? What kind of job leaves you with severe PTSD? What kind of job causes you to heavily medicate with illegal substances just to endure another night of work? If you also see that 90% of women want to leave immediately but have no other options, right? So when we're talking about prostitution and commercial sexual exploitation, it's gender-based violence, and women want out but have no means to do so. So we're going to talk about how the link from childhood trauma and prostitution, just as there's a link from childhood trauma with substance use disorder, right? So some studies suggest that upwards of 85% of individuals in prostitution experience sexual violence as children. Average age of entry into prostitution is stated to be 14 to 16 years old. Early experimentation with drugs and alcohol leads to substance use disorder later in life, right? So around 95% of the clients that we serve at Lyft have a substance use disorder. Most develop it as a coping mechanism to deal with the exploitation, and others are exploited because of their addiction. Which came first is neither here nor there. The issue is providing resources and support to assist women in exiting. I think it's important to recognize, too, you know, when we have this conversation about a child prostitute or, you know, you hear that language a lot. You know, most of these women or victims have been sold for sex before they're even old enough to consent to have sex, right? So it's, you know, it's important that we're really changing the language around that. Someone isn't a prostitute, they were prostituted. You know, and for myself, like, changing that shift in language was really important. It wasn't something that I was, it was something that happened to me, right? And so it kind of removed that negative label and allowed me to see this as an experience I had and not something that I was.
And it could be because, you know, a lot of girls at that age don't recognize that this is prostitution, or they might have not had a choice in entering this. So one example that I know of, we were asking a woman, you know, when she started, and she said she had been 25 years out, and we said, well, how did you start? She said when she was 12, her dad put a heroin needle in her arm and said, go out and get me money. And so just that moment, her entire life has changed, and she's been addicted to heroin, and she's had multiple overdoses, and she had been out on the streets for about 20-some years. So in Worcester, with the women that we work with, 97% have substance use disorder. We already talked about homelessness or no stable housing. They have unmet needs due to unaddressed trauma, shame, and the stigma of being a prostituted person. The majority of the women don't have a safe place to go post-incarceration, and often they get returned to the streets, leading to dangerous and fatal results. So when women get released from jail, they have nowhere to go, and they are often put on the corner where they were picked up in the first place. And so they get stuck in this infinite loop of, you know, being released, being arrested, being jailed, you know, being released, and so on. We've had now 14 women who've died in the last 2 years from fatal overdoses. And as I mentioned, there's a chronic recidivism in this population. So the majority have been arrested at least once for prostitution-related offenses, and 44% were arrested 4 times or more, with one woman who was arrested 27 times. And this is based on police arrest records for the last 20 years. And it's very common for the women, again, because of homelessness and substance use, to be rearrested within days of release. And what we're seeing is that 10% were rearrested within a month of their release from jail, and 3% get rearrested within a week. So again, this recidivism, this revolving door of being involved with criminal justice is really important to understand when we are talking about prevention and intervention and treatment.
So also, when we're talking about that, so it says 91% of the clients had been arrested. Of those 91%, 60 had lost count of the number of times they had been arrested or had been arrested 10 or more times. 58% had overdosed, and of those 58%, 75 had overdosed more than once, and 65% are homeless. So this is data that was captured at the drop-in center. I mean, I can tell you anecdotally, you know, there's a woman that, you know, is coming into the drop-in center now. She's been out of jail for 3 weeks. She's already overdosed twice and been rearrested, and that's in 3 weeks. And then another woman, you know, just was out a week, and I was at the hospital this morning with her from an overdose. Now, this is someone that's been a victim of violent crime. This is someone that's, you know, suffered immensely. And, you know, unfortunately, like at the drop-in center, we are arming everybody with Narcan, and we know that this Narcan is being reused to reduce overdose deaths in our community. But unfortunately, like Marian said, we have no treatment resources available for them coming back into the community. And even if we do connect them to treatment resources, if they have no safe and stable housing, treatment is not going to be effective. We also are seeing, as you can see, the majority of women in prostitution have been arrested multiple times. So it's difficult finding and keeping employment. You know, I often share that, you know, because I was a victim of commercial sexual exploitation, yet I was I have numerous prostitution-related charges on my record. I often share that if I wasn't doing this work, I wouldn't be doing any work because nobody would hire me. And imagine how re-victimizing that is to sit across from an employer and have to explain away the umpteen prostitution charges on your record and what that feels like. So we're not, you know, until we shift over away from arresting victims, provide vacatur for women that have prostitution convictions or are stealing records, it's really, really difficult to get out of the life, because without employment, without stable housing, without treatment for substance use disorder, it's you know, you get trapped in that cycle.
And as Nikki was saying, you know, we just cannot arrest our way out of this problem, right, out of this issue. And this is the important part of understanding what the drivers are, what the vulnerabilities are, what are the determinants of it, what the needs of the women are, and why they are stuck in this revolving door. By understanding that, you're understanding the whole person, not as a criminal, but as somebody who needs help along the way. So this, you know, community health, public health approach is really important to use as we are addressing the issue of prostitution and commercial sexual exploitation.
So some of the most challenging barriers with exiting are the lack of treatment for substance use disorder, chronic homelessness, as we've talked about, the inadequate education and job skills. As we talked about earlier, average age of entry into the life of prostitution is 14 to 16 years old, before they're old enough to consent for sex, but also before they're old enough to be gainfully employed, right? So women are getting into the life with little to no education or job skills and getting out of the life 20 years later in that same situation. Lack of positive social supports, which is really, really so important in supporting survivors and exiting, you know, which is a lot of what we're doing at the drop-in center. So we're building relationships with women that have like very little to no positive social supports. Another important piece of this is that at the drop-in center, the majority of our volunteers are also survivors of the commercial sex industry. So it provides hope in that moment, and women aren't as hesitant to disclose because we use the been there, done that approach, right? So it's not so scary for women to identify as somebody that's been in prostitution when they know that everybody, almost everybody there has been as well, right? There's a lack of knowledge about available resources. And then former convictions of prostitutions and drugs, right? So as a city, we've really shifted away from charging women with prostitution, but that doesn't mean they're not being charged with other crimes. And as we're changing the language here from drug addiction, and we're changing away from, getting away from this like war on drugs and locking people up, it doesn't change that all of these convictions are still on their record, and we're still charging people with these crimes, right? So there's a lack of trauma-informed and appropriate programs that address all of these factors simultaneously. Also, like women, victims and survivors have a difficult time succeeding in traditional substance use disorder settings or domestic violence settings due to the double stigma with their histories. They have difficulty assimilating into populations who may cast judgment, right? So we really need survivor-specific treatment for them. So we're changing away from addiction as a moral feeling to addiction as a disease, right? So for years, we've treated addiction as a crime, just as we've treated prostitution as one. Survivors leaving the life often carry over a criminal record heavy with prostitution and drug-related crimes. This is a doubly stigmatized group of people. Often in treatment programs for addiction, prostituted women have an extremely difficult time acclimating and succeeding, if they even stay, afraid to share about their experiences in the commercial sex industry and not addressing the trauma, so they often return back to using, and often they don't make it, they pass away. So we know that treatment, just like treatment for substance use disorder, medicated assisted treatment is effective, especially with these women. They're struggling from like severe PTSD, so it's really important that we're addressing their substance use disorder and providing resources for medicated assisted treatment, but also for their mental health, challenges as well. So we know medicated assisted treatment is effective in treating opiate use disorders. It reduces drug-related diseases, criminal recidivism, it increases quality of life. And we need it to provide these options because there's long-lasting changes in brain chemistry that can often cause difficulty with abstaining from opiate use. Withdrawal symptoms and cravings can be overwhelming. Medicated assisted treatment can help reduce withdrawal symptoms and curb opiate cravings that can lead to relapse. And long-term MAT has greater than 85% chance of reducing overall mortality among people with opiate use disorders. We see women do really well. Most of our participants that are doing well and are successful have access to some form of MAT, and we've identified certain providers in the community that have a better understanding of commercial sexual exploitation and how that impacts their substance use disorder. So we've been working with a couple of great providers in our community. This is just a stigma campaign that they did in Massachusetts. So again, shifting away from addiction as a choice to it's a disease, just like we're doing with prostitution, right? So prostitution is not a choice. We're not calling it prostitution. We're identifying that these women aren't prostitutes, they're victims of commercial sexual exploitation. And so we've been able to really change that language within our community. Again, if somebody's willingly participating in things, then why should we help them in exiting, right? That's how our community looks at it. So when we're shifting this language to that these women are victims of the commercial sexual exploitation, victims are in need of help and support, right? So we're changing the language of substance use disorder and commercial sexual exploitation.
So for survivors, they face a lot of challenges during their recovery. A lot of them, well, almost all of them, feel doubly stigmatized with addiction and experiences in prostitution. If they say that they were involved in prostitution. Treatment facilities are still archaic in the treatment of addiction, so while there has been some changes, positive changes in the last few years, most programs are still relying almost exclusively on the 12-step programs and not recognizing trauma as a driving factor to addiction. And facilities that we know of are either treat one or the other, right? They treat either trauma or addiction, but it's not both at the same time. And it's really important with this population to treat both at the same time. You can't separate them. They're really intertwined.
Some other challenges we see with survivors of the commercial sex industry within treatment is re-exploitation and further re-victimization within the 12-step community. Often women will share about prostitution experiences and then, you know, essentially be solicited in the parking lot. Limited, if any, access to support from other survivors, which we've identified as really important through this process. Another challenge is that the programs are not addressing the prostitution or addressing it as an afterthought. And that's a mistake that we're seeing commonly. So, you know, really, like, we're seeing substance use disorder, mental health challenges as, like, the primary is that they're victims of commercial sexual exploitation. And we treat it as such, and then the others as, you know, consequences of the life or however you want to frame that. Women seem to do better. You really need to get at the root of why people are using, and for a lot of them, it is their experiences in the commercial sex industry. And then we see minimal programming that provides trauma-informed care, which is really, really challenging. We've lost 14 women within the last 2 years. And this is another woman that I work with, and you know, I thought this was pretty profound. It says, though their death certificate may read overdose, suicide, or homicide, it should read death by prostitution. You know, like I said, we've lost 14 women to overdoses in the last 2 years. That's 10% of our clients. We really need to do better. So we'll talk about supporting survivors with substance use disorder and what we've recognized to be helpful. So we've partnered with local substance use facilities, right? So we're providing groups within our treatment programs. We're training and dispensing Narcan to high-risk populations, so we're making sure that every woman that comes into the drop-in center is equipped with Narcan and knows how to use it. We're establishing a coordinated support system, so we work within a community collaboration of different providers. So we're able to share resources and connect them to what they need. We're also training local substance use providers. We're running support groups and educational groups within treatment facilities, as I said. We're training recovery coaches and community health workers so people have a better understanding of the impacts of prostitution. We're training exited survivors to provide additional support for women in treatment. Again, the been there, done that approach has been very helpful with our women. Instant access to services and treatment via the drop-in. I think that's something that we really need to recognize, that if somebody comes in and says, I want to go to treatment right now, if you tell them, okay, we're going to go back and, you know, come back tomorrow and we'll figure this out, you've lost them. So it's important that you have, like, instant access to treatment, which is why building relationships with community partners is so important. And we're building relationships and trust with prostituted women. And our long-term goal is working towards opening a residential treatment program to survivors, that we can address substance use disorder, we can address the homeless challenges, we can address providing job skills, you know, all of those, and really, most importantly, address the trauma that they've experienced via prostitution.
So some of the challenges and lessons learned that we have learned over the years is that most people relapse multiple times prior to sustained recovery. In fact, I heard one statistic that was people will go through 8 or 9 episodes of relapse before they have sustainable recovery. There's a lack of coordination in case management, being moved from one agency to the other with no coordination, no continuity, is really frustrating for this population, and it increases their chances of being falling through the cracks. HIPAA, the protected health information, makes it easy to quote unquote lose individuals within the treatment system. We can't call a hospital or a treatment facility and say, hey, how's so-and-so doing, because they can't release that information. So the programs lack the capacity or training to address trauma. As we said, a lot of agencies will differentiate between trauma or addiction, but not the two at the same time. And the stigma associated with prostitution makes it very difficult to succeed or remain in treatment or connected. There are systemic barriers, as we have mentioned before, especially with the CORI records, the background checks, or having convictions on the record that makes it very difficult to get jobs or even housing, or even financial aid if you wanted to go to school. And we are using jails as a treatment facility for this population, which is really, that's alarming, if nothing else. And again, there's a lack of coordinated reentry. The moment between being released and coming back to the community, that increases their vulnerability tremendously.
Sorry, in the interest of time, we're going to kind of keep moving on here. Again, you're getting copies of all of these slides here. So we've also realized that access to peer support is really important. We're going to go on to identifying some red flags of working with women in prostitution. You have them here, so I'm not going to read them all. But oftentimes these indicators are similar to some of the red flags we see in domestic violence. So a lot of the questions and responses we're going to have are going to be similar as well. Like a controlling or dominant male figure that's doing all of the talking while victims won't speak or make eye contact is a big indicator of trafficking. It's always best, if possible, to speak with the potential victim alone, asking, are you safe with your significant other? We often see that these safety questions have been implemented in hospitals. I think it's the one of them that is super important is that you're always talking with the potential victim alone. I recently took my son to the hospital, and my husband was there with us, and they asked in front of my husband, do you feel safe at home? Well, how do you think I'm going to answer that, even if I don't feel safe, right? So I think it's really important that we're not just asking these questions in a checklist kind of manner, that we're actually taking the time to do this appropriately. And then there's some other red flags, like such as wearing sexually provocative clothing and, unable to make eye contact. Different service providers and in different settings, the red flags or indicators are going to be different, right? So obviously in a medical setting, a provider wouldn't be aware of different indicators. Oftentimes victims are identifying, and we don't take the opportunity to probe further into a situation by asking pertinent but respectful questions. I often reflect to screening questions when being tested by nurses. It's not uncommon for these intakes to include, have you ever exchanged sex for drugs, money, or shelter? I would answer yes, and they would move on to the next question. So here I am, just having identified as being a victim of the commercial sexual exploitation, and they would check their box and move on. It's during these moments that we need to be prepared with an appropriate response. If they answer yes, what are we going to do to be helpful at that point? So we're going to, the other slides that we have here are how to engage victims. I guess my biggest takeaway there is that it's important to make individuals as comfortable as possible, and it's going to take multiple times to build rapport and trust with victims. People often don't self-identify, so, that's important. And then I think the biggest key points, Marion, when working with survivors is to be aware of your actions, set a non-judgmental and empathetic tone, and treat individuals as trauma and abuse. Always treat someone if they've been exposed to trauma. We bring biases into our work with everyone, being fully cognizant of them and doing some self-evaluation if we maybe are not the best fit to work with these individuals. It's important to know that these individuals are very intuitive, can read people very well. Their life depended on it. I always say treat everyone with dignity, kindness, and respect, and meet people where they're at. And then we've also left you with some national resources, local resources for our area. And, you know, if you're ever in need of, you know, technical assistance or support in this, you can always reach out to us. Our telephone number is on here.
Okay, so we have one question that came in, and the question is, how is homelessness, how is homelessness being addressed with these populations?
So that's one of the biggest challenges that we have is the homeless crisis. Where we are, there's just a lack of safe, affordable housing anywhere, unfortunately. So what we're working to do in our community is provide survivor-specific residential treatment programming here. So that's how we're addressing it here. Everywhere is working on different things. Oftentimes we utilize community resources that maybe aren't necessarily specific to survivors of prostitution, but are, you know, for homeless or other issues.
Okay, the next question is, I'm interested in your language choices, i.e. prostitution versus sex work / commercial sex trade, sexual exploitation, victim versus survivor, especially with the ingrained stigma around the term prostitution.
Okay, so, you know, a lot of times within universities and things you hear the term sex work often, right? So as a victim of commercial sexual exploitation, first of all, sex is not work, and prostitution is inherently violent. So when we label it as sex work, it kind of demeans people's experiences within it. And there's a very few, so like when we're talking about the scope of people getting into the commercial sex industry, there's very few that will like label this as empowering, this is a choice that I've made, right? And it's the majority that enter prostitution because of lack of choices, right? So when I'm talking with women that are in the industry, right, if I said to them, you know, commercial sexual exploitation, they wouldn't even know what I was talking about. I wouldn't have. You know, I identified as somebody that was in prostitution. You know, we're not labeling somebody as a prostitute, right? They're a victim or a survivor, and we're not labeling them those things either, right? But when you're talking about language, I don't know if I'm explaining this correctly. So, you know, so we're not labeling people prostitute, but women that are in prostitution don't understand the dynamic of commercial sexual exploitation. They don't understand commercial sex trade, right? So they're identified as someone that's in prostitution, right? So it depends where I am, what language I'm using. We never use the term prostitute. That's not something that we use. They're not a prostitute. They had been a prostituted woman, right? So it's not something they are, it's something that happened with them. And then when I'm working with individuals, I'm not identifying them as a victim, right? That's not what I'm doing, but I am allowing them to understand their experiences, power dynamics, so that they have been victimized. It's challenging because most women within the commercial sex industry don't identify as a victim, right? I never did. You know, I always was looking for my next victim, and that's a survival mechanism to help get through that, you know.
Okay, so I think also what Nikki is saying is that you want to use the language that they are using, which is really important because that's how you're going to establish some sort of a relationship with them. Okay, next question. Could you talk a little bit about how 12 Steps re-victimizes?
Sure, I can. So oftentimes you know, I'll speak to my own personal experiences and experiences that I hear from women in the life all the time. You know, so what happens is you're going into a 12-step meeting, you're identifying as, you know, or sharing about your experience within prostitution, and then being solicited in the parking lot afterwards. So that happens more frequently than you know. You know, there's also articles and things out there that really go on to show how the 12-step perpetuates rape culture really badly. It's also really difficult to align. So a big piece of the 12-step process, right, is taking responsibility for your part in things, right? So I've had many sponsors or people taking people through the steps that are literally telling people to own their part in their trauma, right? So how do you align with that as a survivor of trauma, right? How do you, like, you know, own my part in being sexually assaulted as a child, right? How do I own my part in being victimized within prostitution? It's not a trauma-informed approach, and not only is it not appropriate treatment for prostitution survivors, we're recognizing that it's not really that helpful with substance use disorder either, right? And so it's just not typically an approach that works here.
And remember that we are talking about the link between trauma and substance use, right? So with the 12-step programs, they're mostly address the addiction rather than the trauma that comes with that. So it's really important to have both of those. Okay, I think that's about it for our presentation. And I think, Susan, you have taken the reins. So
I have, and that was just in the interest of time. Thank you both for this webinar that, you know, is a mixture of, you know, terrific information and also, you know, the personal information that was shared, I think has been extremely valuable. I just wanted to draw our attention for those of you who are still here. We have two other upcoming webinars. One called Empower. It's a community-based approach to improve the care for women and newborns affected by perinatal substance use disorder. And then the second one is Just Talk About It, using mental health education to prevent and treat substance use disorder. We also would like to have you give us some feedback about this webinar. If you could, you know, tell us what was helpful and maybe some information that, you know, you would like to know about. Click on the evaluation link. If you are getting continuing ed credits from MLA, you need to fill out the evaluation before those credits will be issued to you. And the information toward the bottom of the slide is just to how to go about getting the credit for this webinar. So unfortunately, our time is up, but I thank you all for joining us this afternoon, and I especially thank our presenters. All right, we're going to sign off now. Goodbye.
Thank you.
Goodbye.